Hi, aloha everyone. It's nice to see you folks here, especially after lunch, after the lunch break. My name's Kunane Dreier. I'm the Director of Training and Program Development here at Hawaii Health and Harm Reduction Center. And welcome to our session this afternoon around LGB&T, cultural humility, understanding our place. And when I say understanding our place, I am a member. I come from that community. So this the presentation today is more to share the insight into the LGBT community, Mahu community, and for people, you don't have to be from this community, but to get a little understanding of who we are and our place in community. And so I'm excited to see everyone here. And so thank you, Kelsey. And yes, so it's a small group, very informal. As I'm going through slides and sharing, if you have a question or a comment, feel free to raise your hand, unmute yourself and ask. It's very a relaxed atmosphere today. And then also, if you folks want to, I saw Mark put a little introduction in the chat box of, where you are, what you do, that kind of thing. People, this could be a resource for each other to be able to chat and meet people that are also in our virtual room, in our Hollywood squares, I like to say. So aloha, everyone. Okay. So first, I want to thank Heidi and then the conference for asking me to come and share and give a little insight into our community and really around culture humility and what does that really mean or look like when we may be working with or something having some kind of interaction with somebody who may be from our community, right? So I love this theme, right? Right? Moving forward with the wisdom of our ancestors. When we get to the portion of be around Mahu, all our things got passed down, right? Our kupuna, our ancestors. I was taught these things in the way I believe and I see my role, and that's so important, especially within our Hawaiian culture, right? So mahalo for asking me to be here today. So really quick, for a few formalities, right? I'm from Hawaii Health and Harm Reduction Center. So we have a long mission statement in green, but the main points: reducing harm, promoting health, creating wellness, and fighting stigma in Hawaii and the Pacific. So just a little bit, if you don't know who we are located on Oahu in Kaka'ako, and I like to say we work with many of the communities who others don't know how. And our agency is at the intersection of criminal justice, HIV and Hep C care and prevention, mental health, substance use, houselessness. And what we know is that when someone comes into our doors looking for a service, many times for many of our people coming in for services, they might need or access or benefit from any of the other services. And we have about 25 programs here under our roof. So just a really quick introduction of the agency. Okay, so getting to know the room, I'm just curious, and you folks can raise your hand in the virtual hand or virtual reaction. But just before, as we roll into this, how many of you know personally an LGBT individual or a Mahu, someone who identifies as Mahu? Okay, I see hands coming up. How many in your role within your work that you do have provided services, support, worked with someone who is from the LGBT community or identifies as Mahu? And then really quick, I just want to say, of those who may have not raised their hand or don't know or don't think or was saying, no, I've never have, my question is, how do you know?
Where's the virtual hand?
It's somewhere on your computer. I think everybody's setup is a little different, Mark. Sorry, but I saw you raising your hand, Mark, so you're good. Yeah. So I just like to do that to kind of get a sense of the room, and thank you everybody for raising your hands. You know, we are around more than you think, and sometimes without even knowing. Okay, so our time today, and we have 1 hour or about 50 minutes. We're going to talk a little bit about cultural diversity, a little bit of our, you know, when we think about LGBT, everybody, this concept of LGBT is Western. That's a Western concept. But when we think of local, right, our Native Hawaiian culture, even our Pacific Island cultures, we have a place, right? We've been here. And so two different worlds almost, right? Two different perspectives. So we're going to talk a little bit about Mahu and what that looks like here locally, Native Hawaiian culture, Western culture and their perspectives. And then really quickly about some tips and tricks around providing services and some of the barriers that we as LGBT individuals may experience when seeking out services. And then of course, anytime you want, just ask a question. So Lisa, I see your hand up. I'm not sure if that's from the getting to know you or if you had a question.
Sorry, just answering your question. You know, if I identify or have worked with LGBTQ patients.
Okay, perfect. I didn't want to ignore you. So thank you. Perfect.
Mahalo.
So objectives, and these were in the program for the conference, right? Increase understanding and insight into our LGBT community, increase understanding of the historical context of Mahu in Hawaii, understanding between the cultural and Western views. And sometimes for some of us, how do we live in both of these concepts or in these worlds? And then hopefully some increased skill around delivering culturally responsive services. Disclaimer, I'm not here to change you. I'm not here for recruiting. I'm not here for recruiting. However, I am hopefully going to be able to share some information that you, no matter what your beliefs are around the LGBT community, that this will provide you a little more insight and understanding that perhaps may change or help you when it comes to the community. All right, so really quickly, pride, right? Our gay pride, as you hear it. I put this in here because October is Pride Month on Oahu, right? October 15th is our big, huge parade that's going to go through Waikiki. I'm happy to report that our Pride Parade is the largest parade in the state of Hawaii. We have exceeded the Aloha Week Parade, the Kamehameha Parade. We are the largest parade in the state. Isn't that exciting? So October 15th, parade festival through Waikiki, and the festival is there, but is at the Shell. But just really quick, right? That's our pride flag, the rainbow flag. It's supposed to be all inclusive of coloring. And when it was originally done, there was also a turquoise stripe in there included, but manufacturing the flag, they couldn't do more than 6 colors. So that's how we got the rainbow flag. And the other flag on our slides is our transgender pride flag, right? So you see, when you look at it, if I didn't have the black border around it, but it would be equal pieces of pink, blue, and white for the transgender community, right? And yeah, so those are our 2 flags that I'm throwing out there today as we lead into Pride Month for Oahu. And actually for much of, because Maui also celebrates Pride in October. Okay, let me breathe. And if I talk too fast, somebody say, excuse me, slow down. 1 hour. Okay, cultural diversity. You know, we think about it, we used to call this training or this presentation cultural competency. And what we learned is that I'm going to talk to you for 50 minutes and you're not going to be competent in our community within that 15 minutes, so we can't do that. But so as we think about culture, right, an integrated pattern of human behavior, right, that can be language, practices, beliefs, where we live, right, that kind of thing. There's cultures, and then there's culture within culture, right? All of these little small demographics, small communities, right? So here, I identify as Mahu, LGBT. I'm Native Hawaiian, Caucasian, Chinese, I live in Hau'ula, I work in Honolulu. So I have all these different pieces of me that create my culture, right? So my identity, and then it's like, how do I identify in what setting, in what place, right? But all of these different things all are part of my culture, right? So each group of people has a culture. And a lot of times, many of us live in different spaces, practicing different cultures at different times. Right? So the dynamics of culture, that's what I just mentioned, right? Our practices, our beliefs, our customs, our role and expectations, that's a big thing too, right? When we think about our family structure or even in your employment, things like that, your community, right? How our manners of interacting, things like that. All of these are different dynamics that are part of our culture. So again, this is where we come into culture humility. When we have this belief or this understanding of cultural humility, right? A lifelong process of learning, and just being able to acknowledge and understand that culture and people change, and I always need to be able to learn and change and understand that when I walking into a community or working with a person, right? Culture, their culture and who they are is going to be different, right? 50 minutes, here we are, LGBT, cultural humility. You're not going to leave here culturally competent in that sense, right? We're not going to have the full understanding. But if I continue to always look at a situation or a person as I'm open to learn more of who they are, then I have cultural humility. So the intersectionality, again, as I mentioned, all of this plays into who we are, right? And every single person is going to be different. Their wheel is going to be different. But we have so many different things in our lives that cross paths that make up who we are as an individual, right? I can't assume, or I shouldn't assume, that everybody who I see in these Hollywood squares is all the exact same person. It just doesn't happen that way. Yeah. So we can't just if we can understand everybody is different. Okay. Any questions on culture humility? Okay, good. Okay. A little bit now, culture and history. And this is, I'm going to talk a little bit about our Native Hawaiian history and culture and our role as Mahu. And just some of the concepts, right? This whole concept of family, ohana. This picture here is, we did a retreat a few years ago. We brought together 110 people from across the state, all islands and the Pacific. There were a few people, various backgrounds, right? Heterosexual, mostly gay or MSM Mahu, Pacific Islander, Native Hawaiian, Asian Pacific Islander, and everybody came together, and most of us didn't know each other. But by the time we left on day 3, on that afternoon, we were one big unit, right? Because we bonded so quickly, right? And that's this whole concept of family, of ohana. And we talk about that in our community a lot, because for many of us, we have a chosen family along with our biological family. So family is really important, not just here locally, but in our Native Hawaiian culture, but even within our LGBT culture. Okay, so some terminology, really quick. I have to watch my time. Noho or moi aikane, which is to cohabitate as male with male or female with female. It's again the roles, right? You hear in our history that the role of aikane could be kind of like an assistant, or the personal assistant type to royalty, to the king or something, or it could also be aikane in the role of that has a more personal or sexual role within the relationship, right? So aikane, but is male with male, female with female. So noho or moi aikane, right? To sit, to sleep with the same gender. Mahu, when we think of that word or we hear that word, it's according to Lauren Andrews' dictionary, right? And hui, a man who assimilates his manners and dresses his person like a woman, right? Born with 2 sex organs and homosexual. But mahu, and I'm going to talk in a few minutes, we had a place. And I think another thing to remember with mahu, when people will tie this word or the identity in the Western concept of being transgender, but with mahu, there wasn't necessarily the desire and to go through the medical procedures of becoming either female or male. So history, right? We Hawaiians had for many, everything was passed down orally. We didn't have much written down. So my colleague, Kathy Kapua, did a bunch of research to see how far back could we find information around mahu, right? And so back in 1838, there was a journal from Reverend Cochrane Forbes, and he writes about coming across or interacting with someone who identified as mahu, right? One man who was never dressed in male costume from his birth now labors under conviction. And he goes on and on and on. And then I told him that if he would be a follower of Jesus, he must make no reserve. And then talks about he has a hard conflict with his pride. But the sinner must be willing to do anything for Christ. And this is where I get on my soapbox, because this is where we see some of the documentation of when we were told we were wrong, right? That when we were told that who we are as a person, as a people, that we were wrong, right? And so this is where I get on my soapbox, right? And this is, again, Western concept coming into our culture, interacting in a way that was negative. And there's a whole long content or a whole long history of Western and colonization and everything with our people, right? The language, the hula, all of this. But again, with our mahu being told we were wrong. So mahu and Hawai'i, right? Mahu is a cultural term. It means to be privileged, right? The mana of both Kane and Wahine. We live on this spectrum in these worlds that we coexist with both, from male to female, Kane and Wahine, and then in the middle, right? We have the essence of both, right? We were a part of the society, of the community. We were valued and respected. Healers, teachers, right? All of this, we had a space. We were respected. We had a role in our family, in our community, right? Role and responsibility. Kulana and Kuleana. My mother is 94, and I was born into this role that I want to be her caretaker, and I always looked at it as because I'm the mahu of the family, right? That's the way I receive this responsibility of being the caretaker in my family. Is part of my role of who I am, right? And then I was born into this role, I'm single, no more children, it's going to be you, right? My siblings are all different, have families, so, but role and responsibility, it came with, being mahu came with kuleana, came with, with this, who we're supposed to be and what we're supposed to do in the community. And for many of us, you can't walk away from that, right? You're born into this role, right? So we talk a little bit about have male and female, ku and hina, right? And amongst our friends, we always talk about, oh, I gotta channel my ku, right? It's like when I gotta kind of butch it up or whatever. That's our little inside joke, is I gotta have a ku, right? I gotta get my ku on, or hina when I need to soften things up, right? And so for mahu, we have both, right? And the essence of ku and hina. And in reality, everybody does. Every single person has a little bit of ku and hina. It's just, how do we connect or identify with that part of our identity, that essence of who we are and how we put it out there, right? I have to say, I believe 100% that everybody has both. We just express it a whole lot more and are able to fluidly go back and forth as needed. So good recent example of where Mahu came into play really at the forefront was with the whole Mauna Kea, what was happening up in Mauna Kea. You know, our kupuna were up there, you had your men, you had the kane, you had the wahine, and Hina got this call from one of the leaders up on the mountain, we're missing the Mahu, we needed the Mahu up here, right? And so we gathered, everybody gathered and responded. And then after that, every time you saw, you know, a march or whatever, always the Mahu were at the front of the forefront of the walking, always part of the ceremony everywhere, right? It's so important, right? And so this group, Mana Mahu, was formed as a result of the calling. So again, Mahu is a cultural term. Mahu was in the past, me growing up, very negative. It was used negative. You know, you would hear somebody say, hey, Mahu, and then next thing you know, you were going to have to fight, right? That kind of thing. So our transgender community despised being called Mahu. But they've reclaimed the word a while ago, it was probably early 2000, where they said, we say now Mahu Wahine or Mahu Kane, right? So, and that kind of gives it a little bit more context, a little more value, a little more respect to the word, and gives them a little more identity, right? Mahu Wahine, Mahu Kane. And so we've reclaimed the word. There's still sometimes people use it negatively, but for the most part, we have, like, as you heard me say all morning or all afternoon, I identify as Mahu. Yeah. I also, depending on my setting, right, I could use gay, LGBT, that kind of thing, but Mahu definitely is not in my use negatively as much anymore. And just like the LGBT community has a long history, right? Or Pride started off as a riot. It was never a parade. And so there's a history. And our local history here in Honolulu, some of you may have heard of the Glades that was down on Hotel Street. It was our entertainment, our bar, our club, where our Mahu went to work. They entertained, right? And but they had to wear this button, I'm a boy, because the sailors were getting confused and there was all of this kind of stuff. And so they made this rule. It wasn't a law, but so the police would check to make sure that the girls had their buttons on and things like that. So we even have our own history of how we had to kind of stand our ground to get to the place that we are today. It's really interesting. There currently is a display at Bishop Museum, Kapai Mahu, about the stories of the healing rocks, the stones, and there is a section in there about the Glades. You should, if you have time, go see it. It's only there till mid-October, so don't wait. But we have a long history of us having to stand our ground to get our place, right? That respect in our own community here. So when all our non-Western communities or people or islands, right? So in the Pacific, all our cultures have LGBT or Mahu, and they have their own word, they have their own history, they have the same respect and place in their families and communities. And so there's other cultural terms depending on who you're in front of, right? Who you're talking to. But it does show that across the Pacific and in some of our other countries and places, Mahu existed and are very well respected. You know, and we go to American Samoa. My friends are all their teachers, their principals, they working in the government, right? There's a place. We all have a place. Okay. So again, I brought up ohana or family, right? Biological versus hanai, right? We have our biological family that always doesn't necessarily understand who we are. And then we have our Hanai family, our chosen family. So here's a little example, right? Our biological family, sometimes they don't understand, they don't agree, they don't sometimes support us, they put us out on the street. And so for our biological family, they also have to go through, I like to say, they too have a process to go with to come to a place of understanding of who we are as and how we identify individually. And so I had a really good friend who called me out of the blue one day and said, Kunane, my son wants to be a girl. And I don't know what to do. And I said, okay. I go, well, what are you thinking? He goes, I just want my son to graduate from high school. The child was in 10th grade at the time. The beautiful thing about this particular situation is because my friend, the father reached out for some, so he could get better understanding. It was a little bumpy, but the now daughter has graduated from high school, graduated from college, and got that support. But we don't see that all the time. And so our young people are being put out of their families, out of their homes. And so sometimes our Hanai family, our chosen family, provides better understanding of what we're going through and how to maneuver these systems and just our identity and our growing pains, right? A friend of mine who is now biologically female, when she was in high school, her parents didn't understand how to do the journey, right? That medical journey. So she had a biological family, her mom and dad, and then she had what she calls her drag mom, who was able to provide her the guidance and support needed to transition. And so sometimes we have to figure out who the family is. When I say I'm going to bring my mom, or somebody in front of you might say I'm bringing my mom, and it's not their biological mom, maybe it's their drag mom, their Hanai mom or Hanai family, that's where they're getting their support from. So that's what's really important, is to know where the support system is coming from. And then in our community, we have different social structures, right? And so this is where even I'm disconnected to some of these little communities within our community, right? So among our gay men, we separate ourselves out by ethnicity, where we live, how we meet each other, age, body type, right? With women, same thing. And then the houses, this is where I was talking about our chosen family. How many of you folks have seen Pose? I see some nods. Pose. If you haven't seen it, if you folks want a good understanding of what our community was like, especially back in the 80s, and I am a child of the 80s. I mean, I grew up in the 80s, and it is, for me, one of the best reflections and accurate stories of what it looked like for us back then. And these houses, right, when kids are being put out of their families and have nowhere to go, these houses were formed, and that's where they got that family structure. But these are houses that we have in Hawaii, Ashton and Chandelier, Armani, Kobe, and they function in the same way any other family unit does. There's the matriarch, and then there's the kids, and then grandkids, right? There's the hierarchy or the level of where we fall in the family, and it's that same thing. You getting that family support. You have a safe space to come to. You would be getting hopefully the same thing you would be, that you're not going to get, that you are lacking at home with your biological family. Yeah, so these are some of the social structures within our communities. Any questions about my quick and dirty, quick and fast Mahu, Native Hawaiian, and our place within the community? Okay. You folks are good. Or you just think I'm fabulous and I'm doing, I'm hitting all and you folks just believe everything I have to say. No, okay, good. All right, so let's go to Western culture, right? When we think this is where the LGB&T comes in, right? Lesbian, gay, bisexual, questioning, queer, intersex, transgender. So, now it's LGBTQIA++, right? There's a whole long list. I'm old school. I'm in habit, I say LGB&T, but just know I'm talking about all of these communities. I'm not leaving any out. So I want to preface that there. So again, this is all the Western, right? These are Western terms, LGB&T. So when we think about individuals, right? Everybody put your hand on your foreheads. Okay. This is my gender identity. This is my sense, my understanding of male, female, neither, both, right? This is my gender identity. If you put your hand over your heart, that's my sexual orientation. This is who I love, who I'm attracted to. If you put your hand on your lap, that's your birth sex, right? Genitalia. And the last one that's not on here is if you just kind of put like this is our gender expression. And I do this because what I want to say is that this, all this, they're not connected, right? One doesn't determine another, right? Each person is different. So gender identity, right? My own identity, my own sense of myself, right? Male, female, transgender, whatever my own identity is. And again, that's mine, not what you're going to tell me I'm supposed to be, right? Sexual orientation, who I love, who I'm attracted to. Gender expression, how I put myself out there. And what I like to say with this is gender, especially gender expression, can change, right? If you catch me at 10 a.m. in a meeting, in a presentation like this, I'm kind of toned down. I may even try to butch it up a little or whatever. That's really hard to do. But my demeanor and my expression is going to be much different than if you're at my house at 10 o'clock in the night and I'm sitting surrounded by my friends and we're having, carrying on. Much different, right? So gender expression will change for everybody depending on the setting. So that's really important to remember. So again, all these gender definitions that we're hearing now, right? Cisgender, transgender, gender fluid, non-binary, they exist. But again, the label and how somebody identifies for themselves is theirs. How many of you folks have heard the term cisgender? That's really been coming up a lot. Okay, I see some hands. Cisgender refers to I identify with the same gender that I was born as. So they think, oh, cisgender, you're straight or whatever, but I am a cisgender gay male, right? So I just like to mix it up a little bit. But that's all that means is that a cisgender, you identify with the gender you were born as. So you're cisgender or you're fall under the umbrella of transgender, but even then you could pick one of these like non-binary or something depending on your own identity. So gender non-binary. It's an umbrella term, someone who is, we like to say gender non-conforming or maybe not on the binary, right? Male, female, you're not at either end. And it's a terminology around people who don't fall your idea of, right? My father used to always tell me, don't bring home anybody, get any girls pregnant, don't do this, right? All this kind of stuff, right? That stereotype of who I was supposed to be as a man, right? But so someone who identifies as non-binary, they're not trying to go for it. They're not trying to be those stereotype of male and female. So when we hear the terminology transgender, most people think trans man, trans woman, right? You're trying to, don't identify with the gender you're born as, and you're doing some steps or something in order to achieve being either transgender male, transgender female, mahuahine mahu. And so that's on the binary, right? Because the person maybe is trying to get to be male or female to some extent, transgender, right? They're living their life not as they were born. And then under the non-binary, it's androgynous, gender fluid, gender non-conforming. All of these fall under this umbrella of non-binary. But with transgender individuals, it both fall under this big umbrella. Does that make sense? Big term, two different groups. Okay, so here, this is how all these terms that we were talking about play into, come into account. And so this little diagram here, if I was to give everybody this diagram, this little chart, and ask you folks to do it, put your X's on the little scale, right? On the, and where does it fall into place? I bet you everybody would have X's and everybody's paper would look different. So this is mine, right? So sex assigned at birth, I was born male, I identify as male, so it's male, intersex, female, right? Gender identity male, androgynous female. I identify mostly male, but again, it also depends on the time of day. Same thing with my gender expression, right? And then my sexual orientation, I'm gay. So that's male, female. Are you attracted to men? Are you bisexual? Or are you attracted to female? So this is my graph. If everybody in this room, these beautiful Hollywood squares, did this activity, I would bet 100% that none of your charts would be the same. Right? If we honestly sit here and think about where do my X's fall on these graphs, none of us would be the same. And that's the beautiful thing about our world, right? We don't want 100% of the exact same person. Oh, that'd be so boring. Anyway, soapbox again. But then when you think about it, someone who identifies as queer, non-conforming, they're going to turn in their paper, it's going to have no X's anywhere, right? And so that's something to also think about. Okay. So a few more things really quickly around relationships. We put this slide in because we used to always asked this question, right? Everybody, we'd always say, oh, if a transgender girl, if a heterosexual or guy is in a relationship with a transgender female, people would automatically label him as gay, that kind of thing. But what I want everybody to understand is that it doesn't matter who, right? Male, female, female to male transgender, male to female transgender, that person is in the, is in the middle. We could be in a relationship with anybody, right? Any identity, anybody with any identity. The definition of the relationship is theirs. We shouldn't, again, we shouldn't be putting a label on this, right? Because I have a very dear friend who is a transgender woman, identifies as female. She's in a relationship with a heterosexual male, and they define their relationship as heterosexual, right? I have friends who are transgender male, transgender female in a relationship. They also identify as heterosexual. So it's not up to us to say, oh, this person is gay because they're dating somebody who we think is, whatever that may be. So that's really important. Always ask who's your partner, what your relationship, and that's also only if you need to know. Pronouns, comes up a lot nowadays, right? The pronouns, he, him, his, she, her, hers, they, them, theirs. We have some others that are popping up on the continent, the Z, the hair. These are popping up on the continent. I haven't really heard them here used locally, but they exist. So it's good to know. And if you're not sure, just ask, right? So in my Zoom box, I have my pronouns, he, him, his. On my email, I have him. We shouldn't leave it up to somebody who is transgender to have to tell you, I prefer to use she, or I prefer to use he, I prefer to use they. This should be something that we should normalize in a way that everybody feels comfortable. But here's the kicker. This is one of my favorite slides too. Olelo Hawai'i, our people, we're ahead of the game. We were doing this way before we needed to, right? So when we think about pronouns in Hawaiian language, oia and ya and kona and kana for he, him, his, hers, all of that, there was no gender attached to the words we used in our Hawaiian language. We were ahead of the game, people. Okay, anyway, again, soapbox. Gender neutral language or pronouns, we should all be using it. It shouldn't be that somebody who identifies differently needs to always tell us. right? So who, we should all do it, and then why? Because it creates the space of acceptance, of respect, it builds a relationship, and we go much further as service providers or even friends and family when we're able to show that respect. I'm watching the clock so that we can, I talked about this. Gender, you know, when you gender neutral language, or just avoid using, you know, I always get, and you know, God bless the people at, you know, McDonald's and Jack in the Box. I always go, yes, ma'am, yes, ma'am. I have a naturally high voice, and then I pull up and they're like, oh, but you know, we had one person who always said dude. Didn't matter who it was, but always said dude, but it made some of the girls uncomfortable, right? So how do we use language that's not so, that's more accepting and inclusive? People first language, right? Living with HIV versus HIV positive, person who uses substances versus drug user or addict, right? We're talking about the person first, and everything else comes secondary. Okay. Providing services really quickly so that I can give you some minutes to talk story. I'm at 1:16. Some of our local LGBT&T issues, right? Stigma and shame from within our own community, in and outside of our community. You know, there's a lot of stigma still that exists in the world when you, for people who identify as LGBT or Mahu, that can also come from within our own community. I like to say, not at my dining room table. I experienced this, I coined this little phrase because growing up, my best friend, her family just loved me to death. I spent like 5 nights a week there. When her younger brother came out of the closet, they disowned him. They told him to get out. And I couldn't understand how they could love me so much and not their child. And then I started to see this wasn't just an isolated incident. It was okay to have the little gay friend or the Mahu friend, lesbian friend, whoever, but just don't let it be my child. There was a lot of that in our world. And I'm happy to say that's all changed and the family, you know, reunited and everything. But it happens not at my dining room table, right? Our culture, our lack of knowledge as an LGBT that we're even at risk or services exist, or where can we go to get services that are supported, right? We have higher rates of substance use, intimate partner violence, and suicide within our community, or high rates. And then of course, lack of family support. We just don't have it sometimes. So, you know, trying to come in to see you folks, we're gonna be judged. They're gonna judge me. Oh, he's Mahu, he's doing these things in the dark, right? I'm not understood, right? Or I deserved it. If you weren't out at 2 o'clock trying to, doing sex work, you wouldn't have gotten beaten up, right? Being called by not their preferred name or the name that we go by, that's a big issue, right? I have tips on that. And then the myth that every transgender girl is a sex worker or going to be a showgirl in a, you know, in the drag show or something like that, or every young boy is looking for a sugar daddy. That's not true. Guilt by association. I don't want to go in there to get a HIV test because they're going to think I'm doing something bad, that kind of thing. And then lack of training for the staff that are working at some of these agencies. But here's some tips, and then we wrap up. Provide a safe space. Always, as much as you possibly can, use the correct pronoun, correct name. You know, I know our data systems, or we got to use legal name, what's on their ID, and that's fine and dandy for record keeping, billing, whatever it is that you need to do. But that doesn't mean you have to call the person by that name, right? It doesn't. That person's going to walk out. So if you have a place in your system that you could say, we have nickname in our EMR, and so that's the name that everybody's going to use, and that has to go from the first person they see to the last person they see, always using the correct name, preferred name, chosen name, I like to say. All people first language, right? Standardize all your questions. Don't ask me only certain questions because I'm Mahu or the person is transgender. We miss the opportunity. And when we tell somebody, I ask everybody all the same questions, it takes the stigma out, right? When I'm talking about sexual partners and I say how many men, women, or transgender individuals have you been with in the last 3 months? It doesn't matter who's sitting in front of me, but the stigma is gone when I say I ask everybody these questions. Like they don't think I'm asking them because I think something about them, right? Focus on their need and not their identity. if you can, have some local LGBT staff member. Respect confidentiality, because we know and we talk. And if we come in and Kelsey goes and tells my story, whatever, to somebody, we're going to say, don't go see Kelsey. Kelsey tells everybody your business. And so we're no longer going to go there, right? And so we're a small, tight-knit community. We don't necessarily know everybody, but we do know where to go and get services and support. Manage your own discomfort when I tell you my stories, right? That kind of thing. Be client-centered. And then I said, well, everybody does. Check your privilege, because what was easy for you may not be easy for me. Getting on the bus to come see somebody is a big deal for some of our people, right, in our community. So just have a little bit of understanding. And then always asking the correct questions. If your agent or program or whatever is interested and wants to know if you serve transgender clients, 2-part question: sex at birth, current gender. Those 2 questions, if they don't line up, then you know the individual is transgender. And then really ask yourself, do you really need to know? Are you asking the question because you maha'oi and just want to know what I do at 2 a.m.? Or are you asking a question because it's pertinent to why I'm sitting in front of you? Very important, right? We have a lot of people who are very curious to into our lives. And then policies that you could have within your program. And I believe I'm going to upload all of these slides into the portal with the schedule and everything, so you'll be able to get them. But I'm going to do one last shameless plug. Here at our agency, we do have our Kuana project, which is our transgender social services program. And Kuana means big sister to a little sister. So it's really getting our community together to provide that support one-on-one, right? And our big sister to a little sister. What does that mean? How do we give you support in a way that these are the things that I did, I lived through, I worked through, that kind of thing. Yeah. So Kuana project. And there's a whole list of resources. And the last thing is, are you an ally? Are you going to stand up for us when no one's looking, or only when we're in the room? Yeah. Telling me I know somebody who's LGBT doesn't mean you're an ally. Telling the person next to you who's talking about me to be quiet is an ally. So, yeah. And then a little bit of our services. Okay, we're at 122, we're good. I'm gonna just skip through this. Here's a picture of our agency staff. We have about 100 people now, it's crazy. But I don't know if anybody has any questions. I would just kind of whip through this with my 1 hour. Anybody have any questions or thoughts? Anything you want to share with me that maybe I should include or add into this because of your experiences? That would be fabulous.
Is there anything on Maui, like that agency you just showed? I didn't catch the name real quick, but that's a support agency on Maui.
Yeah.
I work with a lot of families and with kids that are transitioning, and wanting to build a support system around them. So
yeah, so on Maui, you could call Tiare at Maui AIDS Foundation. They have a similar program to our Kuana project. So Tiare at Maui AIDS Foundation would be a great start. And I'm trying to remember the clinic that's right across the street from them. There's a health clinic. They actually do transgender care, transgender affirming care. So
Okay.
Another resource on Maui.
All right. I know Tiare. Okay.
Okay, perfect. Wow. You folks are so quiet. Lunch is kicking. My lunch is waiting. They was knocking on my door to bring my lunch. I told them that. I was like, don't interrupt. So.
Can I ask, LGBTQ?
Yes.
Right. The Q, some people say queer, some people say questioning. So when I look at your umbrella, transgender umbrella, and then you have the non-binary.
Yes.
and it seems like there's a lot of fluidity under the non-binary.
Yes.
I wonder if that falls under the Q questioning, or if that's totally different, or that's different.
So there's, well, with the Q, so Q, so queer. So again, me growing up, queer was a very negative word, but today, many people they've reclaimed that word, and it's not, doesn't carry such a negative context. So queer, again, it's somebody's individual identity where they would fall, but I would say yes, queer itself, that identity would fall under the non-binary, more so than under the transgender side, or the male to female, female to male. Questioning that, so other people, you know, when they see the Q in there, they always say questioning, right? When someone's still trying to discover who they are, their identity. And so that's also there. But with questioning, you know, they'd be changing their mind. They could be changing their mind on a daily basis. In fact, all of us can change our mind. I could wake up tomorrow and say, I'm going to be straight or heterosexual. I don't think it would happen, but I could.
All right. Thank you.
You're welcome.